Whenever you breathe, your pulse can go away. Why is this? Cardiac tamponade. That's what we should think for step one, right? So somebody has shortness of breath on mild exertion, that's like decreased cardiac output, and they have JVD, so that's going to be your elevated venous pressure. That's a hallmark of cardiac tamponade and heart filling problems. And so what's going on? Cardiac tamponade, JVD, pulsus paradoxus. That's when you kind of inspire and your pulse changes. So this will be caused by viral pericarditis, Beck's triad, hypotension, low blood pressure, distended veins, muffled heart sounds, pulsus paradoxus. It's going to be greater than 10 millimeters mercury whenever you're inspirating. Like your systolic blood pressure will drop. Inspiration causes the right ventricle expansion. So your right ventricle is going to expand, and it's going to decrease the left ventricle filling, and that decreases the systolic blood pressure of the left ventricle. So it's like that the compression is going on because when you inspire, you are going to be expanding your right ventricle, and then that will shift the septum over to the left ventricle, causing less systolic blood pressure. ECG will show low voltage, and also you might see electrical alterons. It's like just like flipping around in the heart, and it's just kind of weird to look at. There's another GIF in a video that I made previously. Enlarged water bottle shaped heart. So let's look at this. We got a 30-year-old man, dizzy, hypotensive, deep inspiration changes, classic cardiac tamponade. Okay, let's look at some other ones like acute MI. That would be sudden onset. Oh, my chest is hurting, cardiogenic shock. We got pulsus paradoxus not seen in this individual. Acute viral myocarditis, that'd be inflammation of the myocardium that causes severe left ventricular dysfunction, and pulsus paradoxus isn't going to be seen here. Cardiac tamponade, great, we love it. Beck's triad, we don't, you know what I mean. Pericardial fluid accumulation, constricted pericarditis, scarring, loss of elasticity in the pericardial sac. That's going to be your constrictive pericarditis. So the pulsus paradoxus isn't going to be as associated as it is with cardiac tamponade. With constructive pericarditis, you got the fibrosis, you got the scarring, and the loss of the elasticity. And so another thing for pulsus paradoxus can occur with like asthma, chronic obstructive pulmonary disease, and less frequently can occur, but less frequently with constrictive pericarditis. But that's caused by scarring. That's the big thing we think of. Several weeks and months to develop. Septic shock could be another one here. Warm extremities, no pulsus paradoxus. So septic shock, what we think of there is we have an initial hyperdynamic state with increased cardiac output. Pulsus paradoxus and weak pulses aren't going to be seen here. And then they might also ask you about tension pneumothorax. That's going to be absent breath sounds. So yeah, just absent breath sounds on the affected side. And then tension, you're going to have maybe your tracheal deviation as well. So the breath sounds you're not going to be seeing on the effective side. It's going to be absent on the effective side with hyperresonance to percussion. Echo. And another feature of the tension pneumo is going to be tachypnea. Tachypnea, you're going, and then tachycardia, and hypotension, and distended neck veins. So tracheal deviation is going to occur on the contralateral side. So there we go. Hopefully this is helpful. Beck's triad, good to know. Cardiac tamponade, pulsus paradoxus because of that compression to the left ventricle, and could be like viral caused.